Good afternoon, ladies and gentlemen. Welcome to UMedTV. My name is Kemal Erkan. I'm your host for today, and I have Sean Donegan with me. Sean, how are you doing?
I'm doing great, Kemal. How are you?
Good. In our political series today, our episode number 4, our Delaware Insurance Commissioner position is going to be discussed, and we have one of the candidates who's running for this position for the primary for the Democrats. Mr. Kayode Abegunde is going to join us. So this position is extremely important for most of the Delawareans and other states as well. So we believe that bringing our candidates and getting to know them is extremely also important. So that's what we are going to do today. So without delaying, we are going to let him in. So he's going to join us, and we are going to get to know him a little bit deeper. All right. Good afternoon, Kayode. How are you doing?
Good afternoon. How are you today?
Good. Would it be okay to call you Kay just because on your website it says Kay?
Yeah, Kay. Yeah, Kay. Kate's okay.
That's good. So we never met before. I know you talked to Sean before this event. And as you may know about our channel, what we are trying to do, our goal is to be the voice of Delaware healthcare physicians providers. United Medical ACO is one of the 4 ACOs in the state of Delaware. I should also tell you that for our Medicare program for MSSP, we were number 1 for the program year 2022. And also we were ranked number 17 out of 482 ACOs nationwide. Wow. So we are a little bit proud of that. So then...
yeah, you get busy. Congratulations on that.
Now, but today we want to get to know you more, and as you and I, we never met before. I want to know more about, from the personal side, if you can give us some background, who you are, what you do right now, and then we'll talk about the future.
All right. So thank you so much, and I'm pleased that this opportunity is given. Like you said, we haven't met, but of course, I read quite a number of literatures about you. And for me, when I see people doing good things, it always inspires me. So I've read about you, and I please, for what I know, and been partnering with your organization in some aspect, because I work with people with intellectual disabilities. And of course, we have many of our service recipients that have one provider or the other in your care. So, and of course, that's always been a pleasure having our individuals with your doctors, people that you have there that works for you. And of course, that has always been a success story. So for me, I just want to share that, but my name is Kayode, as you have rightly said. And I've been in Delaware for maybe 17 years now, 17 years, yeah, I believe. So originally from Nigeria. And I'm an accountant. I had my bachelor degree in accounting and my second degree in MBA in finance. So, and I had my other second master's MBA in healthcare administration. So I went further to do my PhD in human services and family studies. So I did that for 2 years before I deferred to run for an office in 2020. So which I done, as a businessman, because I also manage a company called Entrepreneur Consulting. I'm a principal consultant. What we do bookkeeping, we do some part of accounting, we do business development, we do, of course, I do Notary Public, and most importantly, I counsel people when it comes to credit management. So I think, and with my job that I do right now, I work for Keystone Human Services. I alluded to that earlier on. we support people with intellectual disability. It's an agency under the Division of Developmental Disability, DDDS. So we, in Delaware, we have about 64, 65 individuals that we support. We provide home and community-based services too. And my position is the Director of Services. And of course, in Delaware, we're doing well, and our goal is to support and advocate more for people with intellectual disabilities. I think that's all about me.
Well, that's great. So we have something in common. So I was born in a different country. I was born in Turkey, and I've been here for almost 25 years now. So we probably went through some of the similar challenges together.
Correct.
So it's great to see someone like you, like coming from a similar background as I am in terms of what we went through. I did schooling in Turkey as well as here. And also taking or maybe demanding responsibilities in society. And this is maybe what makes this country the greatest in my
Absolutely.
In my opinion. So
Yes.
so then it's almost now 2 foreigners are talking about this public position. So it doesn't happen in many countries, right?
You're right.
And I'm glad to see that. Now, the insurance commissioner position is kind of an interesting one. So not many people really know what it does. But then unless you are in the industry, many people don't even care. But this is wrong, because insurance commissioner, some of the duties, protecting insurance consumers, regulating companies to ensure ability to pay claims, which is important for both consumers and for the providers, reviewing and approving and disapproving rates submitted by insurance companies. So every year, insurance companies, and this doesn't have to be only for healthcare, I believe.
Yes.
They have
all aspects of insurance, all.
Exactly. So those increases needs to be approved by the
insurance commissioner
department, and the insurance fraud and many other
responsibilities,
related responsibilities, which is extremely important. So annual budget is about 30 million. Now, this is your second time running for this position.
Yes, sir.
So now that was back in 2020. Would like to know what do you see differently this time, and so the kind of your vision for this time in 2024 primary. The person who's in this position right now, I believe he's going to join us in the next couple of weeks. Trinidad Navarro, he's been there, I believe, 2 terms now. If I'm
absolutely, yes.
And usually it's kind of challenging. Well, it's called a challenge anyway, but it's a little bit difficult to beat the person who's already in that position. So, but this is your second time, so you feel probably different than what happened in 2020. So we want to hear about that.
All right. So thank you so much. In 2020, when you look at the data, the statistics, I was very fresh and new in American politics. And of course, coming back with someone with our, people with color and accent and all of that. But the most important thing is that for me, what actually led to my coming out to run in 2020, I remember when I first came to the state, all right? I was in New York. So when I moved to Delaware, the very first job I was able to do, you can imagine, a qualified accountant. I was doing housekeeper in this Delaware. So working in a nursing home as an housekeeper as at that time, and a floor tech, I got promoted from being an housekeeper to floor tech. You can imagine, as an accountant. So I look at it, I was doing it joyfully, and people that I work with, they can see the joy in me doing this. I wasn't complaining. But what struck me out of it all is, I was in an elderly woman room, one of the residents in the nursing home. So as I was there, I moved close, I was cleaning the bed, and this woman was crying profusely. And that bothers me. So I stopped everything I was cleaning, the toilet, it bothers me. So I moved closer to her and I said, Mom, what's the problem? Everything okay? He said, on Sunday, that she was going to be kicked out from the nursing home. So you'll be kicked out? Why? But I don't know much, I don't have much knowledge on how things work then. So I began to ask her questions. I said, but why would you be? He said, my Medicaid, my Medicare will stop. And my family members, it has been many years that we've been connected. We are disconnected right now. And again, nobody cares about me. Our politicians doesn't care about us. When she said that nobody cares about her, I look at it, I said, let me go to, maybe I can get more information. I'll be genuine with you. Not that I have anything that I want to do at that moment, like how to help, but I sat with this woman and I was just trying to, whatever way I can, reassure her of greater future. So, but I was just trying to do things in my own way, just to make sure that everything is going to be okay. So, we spoke. What she kept talking about is our politicians are not helping. Our politicians are not helping. Nobody cares about me. Nobody cares. I said, oh, people care about you. Maybe I should go to the director of nursing. So even, you can imagine as an housekeeper, you are going to the office of director of nursing. They will look at you like, look at this one. You're not even in any position here and you want to come and advocate. So my thing is that the energy in me is to advocate for that elderly woman to see what can we do? Is there anything do we have any resource in the community that can help this woman stay beyond Sunday? That was my intention. And ever since then, when I got home, I told my wife, I narrated the whole story to my wife. And my wife said, I have known you from the college while you're in Nigeria. You've always been a student leader. You've always advocated. He said, maybe there's something you can do, because the way you were talking about this, it's like you really want to do something. And I was looking through, I know many people asked me, they said, why can't you start as a county position? Why can't you do a state rep? Why can't you do this? But what I said, what came to my mind then is, I want to have ability not to influence legislation, and also to have that ability and the authority to say, let's consider people that are disabled. Let's consider the elderly. Let's consider the veterans. Let's consider the less privileged. Let us consider the low income. Let's consider everyone. I think when I was talking about that, I feel like even being a legislator, part of legislation, I might push legislation, but you really want to think about the whole thing holistically. So for me, I said, you know what? I think Office of Insurance Commissioner, when I read through the job responsibilities, and I said, I will fit into this, even though I had my insurance background from Nigeria. But here, I have studied a lot when it comes to understanding how things operate. And as a leader in where I work, right, with over 14 years of in my current position. So because I've been in a lot of leadership overall, 18 years in general. But for me, I think I said I'll be able to recruit and bring people together to work and ensure that together we're able to advocate for people and people's needs. So my main goal is to drive a community-based position. It's not going to be a political-based position, and that's why I ran. And then the problem then in 2020 was I was able to, bringing people together is not easy. Mm-hmm. It wasn't easy. Bringing people together wasn't easy. But again, my lesson learned then is, right now I'm out there. COVID affected us. We couldn't go much to people, knocked us. But this time around, we are getting into Sussex County, Kent County. I mean, I can tell you, I must be honest, we did well. We had 46,000 votes in my first attempt. And when I look at the data of everyone, we did very well because the incumbent only won us by 2/3 as at that time. And I only ran less than $30,000. He ran with, I don't know how much he ran on. But for me,
that's actually important. So I want to highlight this because for a first timer, And with the way that you position yourself for this 2020 election, you got like over 40,000, like almost 45,000.
Yeah, over, yes.
And the other side got like 74,000, I believe. So that's a big number. So
No, I think it got 64 thereabout. Does it get 74? I think it got 74. But either way.
You got really well for, again, like that time, for example, I didn't know you.
Yes.
The reason I'm saying that is because, for someone who's being in healthcare and being involved on the politics,
Yes.
like not knowing you, that means this access issue that you are talking about and being on a limited budget, maybe you didn't reach out to so many people. So that's a really important point. So, and again, I look at it this way. Everyone has a shot if they work hard and if they try. And when people feel so comfortable in the position that they are in, usually they get in trouble. And I'm not suggesting that someone should be in trouble, but I'm just talking like
in general.
In general. So it's like this new guy, the Republican guy, Sean will help me with the name Ramosny Swavi. Like he's been working like so hard on Twitter, like, because how I know that is because he shows up on my tweet post, like Twitter. And this is not it's not after the first debate. It was prior to that, at least 7-8 months. So I actually pointed him out to Sean almost 8 months ago, because all we do is see him. Now, after the first debate, he became like a very popular person.
A public figure afterward.
But that's all because he was out there and he was actually campaigning. So this is an important thing. And again, for your 2020, that in my opinion, that's an impressive result. So, and I think that what I'm hearing also from you, what maybe motivated you the most is from the consumer protection and also from consumer access to the care. And those are important. And I want to give you some from my side, from the employer side, maybe I should say. In 2006, our healthcare insurance for our employees were about $250 per month. Today, it's close to $600.
Wow.
So from the business side, what I charge to my clients from the percentage standpoint did not change. So we never increased our fees, but one of our big expense items went up by almost 2.5, 3 times.
Of what you had then.
Right. So, and then I was trying to understand, like, also knowing from as a healthcare provider company, we know what insurers are paying. So that didn't change. So, and I'm like, where is this increase coming from? Like, if they're paying the same amount, if the utilization is same, why are they increasing their fees? And it's not like little amounts. So if you look at the last 10 years, it doubled most likely. So that's why this position must be extremely efficient.
Yeah, and it must be consumer driven.
Right. And also things should make sense. And we know that healthcare is not one piece. So we are on the ambulatory side and we are private practices. But when you go to the hospital side, the same service can cost the consumers 5, 6, 7 times more.
That's correct.
And that's why we are also interested in this position to make sure that it's being represented efficiently. Now, I want to change our focus from healthcare to the climate crisis. So climate change, I guess, is also one of the big items. In my personal opinion, I believe it's being exaggerated because the way that certain things can happen, what we can do for climate change, the way that we are fighting can be different. So in terms of when I had Governor Carney earlier this year, he actually agreed with us when I said, look, don't let people build on these places that's going to be flooded, that's going to be stormed out, right? And then when you let them build more and more and high rises and all that, you are going to get more people who needs to support those places from the ancillary side. So you are actually driving more people into those places. So what's the point of trying to fight climate change by spending billions and billions of dollars if you don't do certain regulations and better planning ahead of time? So that was I would have put my personal point out there. But many of my friends don't agree with me, and you may not agree with me either. But how is that changing the insurance side? And do you see any issues for Delaware in the future?
That's a very good question for me, because just like when you give us your own opinion and illustration about climate change, when you look at, the rate at which climate change, I will be honest, is overrated. And, we all say climate change here, climate change there. But then what are we doing in terms of our regulations? Are we being honest, truthful, sincere, upright, focused about it? When we are making decisions? I will tell you, more often than not, the answer is no, we are not upright. You see legislators, when anything that has to do with climate change, and they know this climate change, the effect, it's across the globe, across the board, and it affects all aspects of operations. It affects all aspects of humanity. It affects us as human beings. But then when it now comes for us to unanimously agree on what we can do to help us neutralize this, or to make sure that even the effect is not going to be much on whatever damages is going to, but then that is when we look at our insurance. Go back to we have health insurance, we have auto insurance, you have business insurance, you have all aspects of insurance. Now, if you go back to just auto insurance, because I live in Bear, and when you look at the crime rate statistics, all right, people will say, oh, Bear area is a very good area, and that's why some people, for their 3 cars, they are paying $250 in premium, right? That is for 3 cars, full coverage. Why you have another person in Wilmington, maybe a Wilmington with a certain zip code, I don't want to mention, I don't want to label any zip code. So now, because of that zip code, you see them saying they are paying for 1 car, 1 vehicle, they are paying $350. Does that make any sense? But it might be as a result of a lot of climate change around that community. Now, we are looking at it, they say, they're paying $350, but my question is, why are they paying that huge amount, and what was the differences, or what is the matrix behind the differences? That is why you come back with, you suggest, as an insurance commissioner, your job is to work closely with your community to understand their problem. But then in this regard, I think there is a red lining. We just have to say it the way it is. There is a red lining. There's discrimination everywhere. We still have discrimination in Delaware. I'm speaking from my own angle, and the discrimination can be both ways. So why do we now have people paying this huge amount for their premium, including same thing for healthcare cost? We still have inequality. We know some people will be treated certain way, and some people, when they want to bring them into healthcare facility, they know where they will put them because of their status. So we have this problem, and until we are able to address equality across the board, there is nothing. We can talk about climate change, but until we get understanding of cultural competence is important for everyone, which means you understand what the other person is going through, you understand where they are coming from, and then you'll be able to make or form your opinion. And whatever legislation that we are putting forward, it helps everyone, not just a certain people. That's my point.
I see. I do believe in some cases, what I see is there's an agenda of some industry. This sometimes can be the insurance companies, it can be the media, it can be the energy, like, all these companies, and then they kind of push their way into these, and then trying to make public perception based on, in some cases, not reality. So when we have really important issues, as you mentioned, like equality is, we are not saying that everyone has to be equal, but everyone has to have equal opportunity, right? So that's where it's coming from. When it comes to the climate change, how it's being exaggerated when we have so many other issues. And then also, like, when we don't have like set borders, like when India doesn't do climate change, what Pakistan is doing is pointless, right? So, and when India has, it's probably one of the poorest countries in the world, although it may have one of the most billionaires number of,
I know.
from the number of people standpoint. If you take 10% of India's population, it makes India the biggest of everything, or it makes India the worst of everything at the same time. So, and I'm not focusing on India, I'm just using that as an example because it's an easier one to use. So, what I'm worried about is, like, as they're pushing these, I wonder if the insurance policies for our homes and other things are going to increase because they are pushing the climate change so hard.
Yeah. So one thing that I just want to do, that even as part of my goal, the rate, when we are talking about insurance products, and most especially on our mortgage insurance, I feel like with climate change, we just need to sit together and be sincere with our legislation. And when it comes to insurance rate and premium as regard the mortgage of our home. Mm-hmm. Because you need to, with insurance, and the most sad part is this: when insured, when you have problem homeowners and you call your insurance company and present your claim to them, mm-hmm. while they were collecting the claim, the insurance premium from you, when you sign all the documents, everything goes well, right? There was no argument. There was no yelling. There mm-hmm. was no back and forth, right? The moment that they signed you that agreement and something happened, which might be as a result of climate change, right? It could be for flood, it could be weather, it could be anything. Now, that is the time the insurance company would tell you, I say, sorry, there is this addendum, there is this caveat, there is this claim, there is this that you have signed. Did you read that part? And they will bring those clauses out. And they will tell you that because of that, we won't be able to cover the effect. It was an effect of climate change, right? But then it affects you. And you think you have this insurance product when it comes and your house is covered. And they mention to you what you have been covered on. But then now for them to indemnify you during the claim, they come back to be something else. We've seen it over and over again. As the insurance commissioner, these are one of those things that I want to look into with committees that will review every single cases that consumers, clients, customers will be seeing with insurance company. We need to treat people like people, and we need to treat people, they paid for this thing, all right? Not until when they need to be indemnified that's where you have problem. We are seeing this, and it has happened to me, right? So I'm talking from experience. My job is to ensure that at no point, if you're going to put any rate increase on anything in terms of insurance premium, we need to look at it, we need to sit on it. And then this idea of signing 200 documents when you are buying insurance product, I want it to stop. Where you can come back on the table, you can bring people who understand the concept of insurance and how it works. Instead of giving your client 50 pages, 200 pages to review, which you know, they're not going to review it within 10 minutes and accept the contract or the agreement, then it's a lie. It means that we are forcing clients to sign documents under duress. We shouldn't be doing that. So my goal is bring people together, let them make, if it is 50 pages, how can they make the 50 pages to be 5 pages? And it covers everything that a customer, a client needs to know about the product they're buying. For me, I think that will help us. And then you will not be seeing all kind of increase of insurance premium, because at that we'll be able to regulate it and we'll be able to manage it effectively.
I see. Now, I'm going to make a little shifting here. So one of the interesting things for me was when I find out the jurisdiction of the insurance commissioner office, I was kind of disappointed. So I'm going to kind of put that in perspective. So, for example, when we say I have an insurance, if let's say Sean from United Medical has an insurance, yes, we are not self-funded. Therefore, we buy the insurance from one of the private insurance companies.
All right.
And that's a fully insured population, and that includes myself as well. Right. But when the state of Delaware or the Christiana Hospital or any other big employers, when we look at them, they are self-funded. However, they utilize the network of the insurance companies. Perception out there is like you think that you have like Highmark or Aetna, but then that's not the case because your employer is self-funded. So, or you are not actually subject to the same rules and the regulations when it comes to the claim. And this is also true for healthcare providers. So when we come to you, your office, or the office that you are claiming for, you are running for, the answer is because 75% of the market is self-funded. So, so then 3 out of 4 is not included where we cannot actually address those claims with your office. That was extremely disappointing. So this third-party administrator, where the insurance company is also the third-party administrator, then we are like, okay, so we are going to submit this to the insurance commissioner because they're not paying the clean claim in 30 days. And then the answer, first time, and I got this answer several years ago, well, we don't regulate the self-funded plans. That's also true for Medicaid. And a Medicaid subcontractors. So I'm going to actually give you a little bit more perspective on this. Half of the market right now, the population we have, 50% is between Medicare and Medicaid. So that means we are looking at the other 50%. And that other 50%, 75% is TPA, the third-party administrator. That leaves us 25% of the total population. And that's for an office like this with so much power, in a way, when we leave the other 75%, I understand the Medicare part because of the federal government, but the Medicaid part doesn't make sense. So in my opinion, your office, the office that you may be occupying at some time in the future, it should be regulating all not just for the fully insured ones. So what's your take on that?
I mean, I would say this. You've made some important points that I embraced, and of course, I share same opinion. So for me, I think every policies, everything has to be regulated equally, all right? And we focus more on it. It shouldn't be, we're going to do this 50% this way and the other 50% that way. No, that shouldn't be our job. Like I said earlier, our whole job should be community driven and community based. So if I know the way Mr. Kemal, right? Kemal. So the way I know you put up that big building, and you employ people, and you care about a lot of people. So my thing, the way I'm going to be thinking is that your role in the community, because everything you are doing right now, you don't want insurance companies to now say, after you've worked hard, you've done all this, and then they're now saying, because it wasn't that regulated about the 25%, right? It wasn't that regulated. That should be your problem. No, it shouldn't be the problem of providers. It should be the problem of insurance company. How can we make this work so that when we sit and regulate this, it's going to be win-win. It's not going to be win on the part of the insurance company, the big ones, that whatever thing they say is final. And then the providers, the doctors or your facility, they suffer it. So for me, I will bring people like you that understand, that will present facts. I'll bring them on the table and say, let's bring the players and let's see where we can leverage the whole conversation, rather than to say, no, we can't do this. My own job, the way I view things is to bring people together and let's collaborate, because there is no reasons why we need to just make sure that, you know what, we cover this, we regulate this, we have regulation on it, but on the other hand, we are not regulating that one. For me, it is unacceptable. So, and that is people like you will be on the table when we make such decision, when we make such call. Thank you.
Well, thank you. That's important, and I think you are going to need a lot of support from the state's regulators standpoint, and we are actually talking to a lot of different officials regarding this issue, because, as I said, when we look at the consumers, this is leaving so many of them, vast majority of them are out of the protection from that point, and hopefully, maybe in the future we can make those changes. Now,
absolutely.
Because there's a primary coming up, and because you have to win in order to go to the 2024. If I were to kind of narrow down this and ask you this question in a way that, if you were to do two things differently than the current commissioner, what would be those two things, and how would you make them differently?
Yeah, the first thing I will ensure, I'll protect the Delawarians. And what I meant by that is, with my current insurance commissioner, I'm not saying that he hasn't been doing his best to protect the Delawarians, but we can do more. We can do more to make sure that our office is used equitably. It's not for some people, because you are wealthy, because you work with big insurance company, and then you ignore and neglect other smaller ones that are coming up, like a private owners of businesses like you, and people wants to do well and wants to make sure Delaware become a state that everyone will embrace. So I will make sure that everything that I do, I consider all parties, and I present myself and everything that I do based on equity, nothing else. That's number one. Then affordability. I want, in a situation where when people hear about Delaware Insurance Office, they will say that insurance office listens to everyone, including people like you. All we need to do is to come on the round table and talk about, present legislations that it will work for you as a provider. And at the same time, I know most times insurance company might have problem with it, but I will do something that will not let them go out of business. But at the same time, I will encourage something that will bring competition and that will also, bring access, market access in Delaware, because we just see more of a restrictive percentage that these are the insurance company, these are the things that you providers can have under the HMO and all of that. That when, for instance, I need eyeglasses. So, but with my eyeglasses with insurance, with my company that I work for, they tell me, oh, we're sorry, we don't carry this. So for me, do you know how disappointing most times when you go to, even before you found a provider that will accept your insurance, but that is not fault of any employee. And that is not fault of employers, but it is the fault of, number one, the insurance commissioner's office, because insurance commissioner's office needs to be able to bring people on the table and to say, how can we, like people who say universal health care, bring everyone to the table and let it be a win-win. So for me, that accessibility and affordability of insurance product, it could be health, it could be auto, it could be business, it could be commercial. We need changes. We need to effective regulations on those areas, which I'm not currently saying. I know my colleague is trying to do what he can do for 8 years, but this is the time for me. You need a fresh look over things. And that is what I'm going to bring into that office. Listen to people, and I'll treat everyone equitably.
Well, no, those are all good points, and it's good to hear. So our goal today was, again, get to know you. And one of the things that I'm trying to do for this year, we have 1, 2, 3, 4, 5 more guests before the end of the year. Next week, Kyle Gay is going to be with us. She's running for the insurance lieutenant governor. November 3rd, Sarah McBride is going to be with us. Bethany Hall is going to be in December, and Lisa Rochester is going to be also in December. We have 2 other people in between. One of them is Navarro, and the other person is, I think she's running for the mayor in Wilmington. We have, the goal is to finish these, and then in 2024, before the primaries, we do want to bring you guys back again.
Absolutely.
Also see how the progress is, how you guys are doing. And the other thing, again, although we want to be the voice of our healthcare providers, I also want to be able to help those who are out there, people in your position, to see if we can actually have you guys heard by more people. So that way people have choices and then they make better decisions. Understanding your vision, your policies, and your plans for the future was our main focus today. And I believe you gave us a lot of good points, not knowing what I was coming into with this, discussion, because we don't know each other and we never talk. So it's always kind of like, I find it interesting in a way that like it makes me excited. So because not knowing what's coming is kind of like what I'm looking for in many cases. So this was a really good conversation. I enjoyed a lot. Hopefully that's the same for you. And again, thank you for joining us.
You're always welcome.
I'm sure to see you again in 2024. And anything that we can do for you, if you need to talk to any of the providers or with us. I should mention to you one of my leadership members, Anthony Anubu. He's the director of contracting. He's also from Nigeria. He's been with us for almost 8 years, almost, like a very nice guy. So he does a lot of policy procedure discussions with the state, and he works directly with me. So anything that we can address from our side, and if you need any feedback, we will be here for you. Well, thank you so much again for joining us.
Thank you so much for the opportunity on your platform. You know, it's greatly appreciated.
Thank you.
Thank you. Bye.
So Sean is gonna join me. All right. I know I don't probably need to tell people that you've been in the room for the entire time. Sometimes they don't know who I'm talking to. So, so this was a good conversation.
Yeah.
I think it's going to do well.
Yeah. I mean, I think just drawing a light on that position of insurance commissioner, like you were saying, the 2 points you brought up with the accessibility and also the affordability. Again, with that particular position covering not just healthcare insurance, health insurance, but like you said, auto, commercial, whether it's homeowners. I think it's good that people actually know that there is an office out there that does actually look at these types of
many
things.
people don't know, and they don't actually
exist,
go after for their rights. So then they're kind of just maybe take those things and not going anywhere. And we actually use the insurance commissioner's office a lot from our central office, and then we file a lot of claims on behalf of our patients because the claims are not being paid. So, and then we'll have more people coming in. So we're gonna shift gears a little bit, and I'm gonna share my screen here, but I need to make this guy. So we have a little bit of time. So I am gonna, okay, 1 second. All right. So in some cases, we try to make some, points. I think we have responsibilities with what's happening. And I want to bring 2 tweets that I recently had, and hopefully we can make a point. So this is tweet number 1. So I'm going to just replay. All right, so why this was a concern. So now Cristiano Ronaldo.
Yeah.
So you can tell that I'm not that much into the soccer, but he's one of the most known, most popular.
He's very highest paid, social media wise, probably the most recognized name. I think he has the most followers on social media of any celebrity.
So what bothered me when I saw this, now, and also we were talking to Kayode earlier, the perception, how industries can actually put perceptions out there, and this is also true for true for the countries. So the issue that I see is now utilizing one of the most popular people, he becomes the face of Saudi Arabia. Now, Saudi Arabia is just 2 years ago, or maybe 3 years ago, this is the country who got one of the journalists killed in their embassy in Istanbul. And they actually were gonna kind of blame Turkey for him being missed, but thankfully the surveillance system, that's really good. So they captured the guy who got into the embassy. So they got someone out of that same building with his clothes, but because of the cameras and all that, they were able to pinpoint that it was not him. So they pretty much just chopped him up. It's almost like The Sopranos, just processed him in the embassy. Now, the most popular figure in social media is representing this country and becoming the face of this country. That was, to me, as extremely concerning. Not to dismiss like the women's right treatment for descendants and freedom of religion. So like you can actually have a different interpretation of other elements of Islam. So you can only be a Sunni.
Yeah.
So it's not allowed. Like in Turkey, it doesn't matter who you are. You can be Christian, you can be Jew, you can be whatever the part of Islam is. But this is the country restricting. You can like just think about this way. You can only be a Catholic. It's the same thing.
Mm-hmm.
So now this very popular guy is representing this country. What do you think?
Yeah, I mean, just other context too, is because I think back it was January when he signed the deal to agree to go play for, I think it's Al Nassr, the football club in Saudi Arabia. So I know other football players did speak out against other professionals on where they're choosing to play. I think a big speaking point on that was the fact of it's not how much you earn, but kind of like how you actually play the game. So they're thinking it's more of a money thing. Since Saudi Arabia is obviously very wealthy, they can afford to kind of just buy his, skill and say, hey, come play here. And then you'll be, like you're saying, the face of Saudi Arabia. And as you mentioned, though, having such a large following, 607 million people following him across social media. So whatever he's doing and whatever he's portraying is just going to be seen by so many people. So it's almost like manipulating maybe like what kind of message they want. So I don't know if he knows the history, kind of what's gone on in the past, however many years of Saudi Arabia. But I think, like you're saying, with that dress, it's part of, yes, he now plays there, but also them saying, now he's one of us type thing.
So he has to do whatever they're telling him to do because he doesn't have a choice.
Right, they're paying him to do that. So.
But that's the danger is now you are making this country's position legit because someone who's trusted, who's extremely good in what he's doing, now is representing. So then they're associating that goodness with this country. So
political,
it's representing that. So it's very interesting. So in a similar way, we have these came back to back, so that's why maybe it got my attention. Another athlete. So let me actually bring this up. So I'm just doing this from the iPad and from the laptop, and it's a little bit difficult. Another similar thing, so that I see, but this time he's not probably paid for this. Novak Djokovic. The way that what they're showing here, how horrible the time in the war, in the civil war that they have back in the 90s, and how his childhood was difficult. But immediately I'm thinking, was he not Serbian? Serbians, this is called Serbian genocide. So the Bosnian War, this is one of the most brutal war in the Europe history in the last maybe 100 years. So, and then yet he's making this legit, and then he's actually rewriting the history. Like he's saying that, my version is a little bit different. And because I'm the greatest athlete, greatest tennis player all time, so I can use that and then just tell people that, well, no, that's not really what happened. So the ethnic cleansing of people in that region was the most brutal there. NATO actually needed to get involved. This is the Bill Clinton times back in 1990. And yet this great athlete is representing this, misrepresenting this. And now this is why we have to be worried about what we see, what we hear in the media more carefully, and it's extremely concerning. So well, those are the kind of like what we have for today. And I know we have other things, other updates. One of the really interesting one in the last 2 minutes, I want to kind of, you already saw that from a real-time, real life experience in business, one of our businesses, the interest rate, how it jumped from 4% to 8.75.
Yeah.
What interest we were paying went up by almost 1.5 times. So I do want to actually go over that probably next week for our last maybe 15
definitely.
minutes.
I think it's a big concern going on in the country right now, and also is contributing to that potential government shutdown. And then we also know having the Speaker of the House being outed and voted out. So there's a lot going on right now. It's a very delicate time, and as you're saying, it looks like those interest rates still increasing, almost unavoidable of a recession beginning.
I don't know if many people are even realizing that. So that's why I think next week we can maybe just spend the whole time for after our guests. We can go over that and also show some of the examples. And I know we are working on the 401k numbers. So we want to actually show some actual
some data,
not perception, but the actual perspective of what's happening from our own numbers. Well, again, this was a good session with our political guest and being able to cover other things. So we'll be back next week. Until then, stay safe and have